Hey, what's up? This is Dr. LeBauer from LeBauer Physical Therapy, and today I'm going to show you how to use the Gemini from my friend Kelly Starrett and the Ready State or Mobility Wad to help your plantar fasciitis, ankle mobility, and relieve some foot pain, so you can even get deeper in a squat. I'm going to show you. I have a little bit of my left ankle doesn't dorsiflex, doesn't bend as well as the right. It does just fine, but I'm always working on it a little bit to get more depth in a squat, because in order to get to a squat, you have to have ankle mobility. So there's a couple things I like doing. Is you take this guy, he's got these nice little grooves, which gives it some good pressure, so you can get your Achilles tendon right in there, but it's not as much as that is getting it up on the kind of outside of your calf area. And what you want to do is just kind of move around till you find a nice little juicy spot, and you can kind of move side to side. So what I'm doing right there is I'm moving my body so it's coming side to side, so that a nice little trigger point gets right into one of these grooves, or you can get it right on the flat spot if that's too intense. And I'll find the spot. Then I can use my other leg on top and breathe into it. So what you want to do is just find a nice little spot here. I can move right into another and just hang out. So there's a couple different ways to do the technique. Is one is find the spot and breathe into it 10 breaths. That's great. And then test your mobility again, pain, discomfort, etc. Or you can stay there for 3 to 5 minutes. That might even be where you prop yourself up against like the couch and just stay there even longer. Or you can kind of roll side, that's a little intense, side to side. I'm just gonna find that little spot and just hang out and wait. Or you can also even kind of pump your ankle, get some mobility and movement in. So that looks like this. And just kind of hang out. So here's the thing, you wanna kind of test before and after. So what does it feel like first? And after, does it feel better or different? So there's two things that I want you to understand when doing self-mobilization, self-MFR, myofascial release, or kind of trigger points, even with a roller. One, you don't need to do it for hours a day, 5-10 minutes max. But there's two results you're looking for. Is one, does it help? Yes, great. So that means that if it's helping, great, and it solves your problems, perfect. But what it really means is that if you can do some movement mobility with yourself, then one, you have the ability to change your pain levels, change the way your body moves and functions. Two, it means that if someone like me, a doctor of physical therapy, was able to look at you, we could even pinpoint more exactly where the problem areas are, so you can get better even faster and become even stronger than before. The other thing I want you to think about is, what if you do this and nothing changes? It doesn't change anything. Well, that certainly doesn't mean it doesn't work. What it means is where you're feeling it, where you feel the tension, tightness, or pain, doesn't always mean that's where the problem is. So that's where someone trained in how the body moves, like a doctor of physical therapy who specifically works in like performance and strength training and pain and injuries, can help you identify where it is. Because sometimes I'll feel it here, but the real problem is maybe in my ankle or foot. Now, if you're watching this video because you have foot pain or plantar fasciitis, sometimes the pain is down here and discomfort's here, but the problem can be up in the back of your leg, your calf, peroneal muscles. It can even be a hip problem, or maybe it's a big toe mobility issue, especially if you're a runner or you do a lot of lunges. If your big toe isn't moving well, you can feel it down through here. So to talk about foot, this is really awesome just to kind of roll back and forth. I'm going to stand up. I'll be out of the frame for a second, but you can just kind of stand into this thing. It feels really good. So you can just kind of do it in a couple different ways. You can even stand into it and get a little stretch. So what I want to look at is before and after. Does that feel better to squat? Yes, it feels a whole lot better. If you have foot issues, I've got another video. It's a foot massage and mobility video. It'll walk you through how to kind of keep your feet healthy. So make sure you watch that. If you'd like some help working together with us personally, What we do is we offer free total body diagnostic exams where we look at your whole body to discover the root cause of the nagging pain or persistent injury you have, so you can become better, faster, and stronger without relying on pain meds, injections, or surgery. Just go to freetbd.com, freetbd, like totalbodydiagnostic.com, or click one of the links below this video, and we'd love to get on a call with you and even invite you into our clinic for a 20-minute session where we talk about what's going on, what you really want to have happen instead, and we'll talk about which program we have that works for you, or if we're unable to help you, we'll point you in the right direction. If you like this video, make sure you hit subscribe, ring the notification bell so you'll be notified when our next videos come up. And grab yourself a Gemini. Give it a try, because there's some other places to use it in your body: hips, back, shoulders. I'll be making a few other videos on how I'm using this at home, before and after kettlebell training, before and after runs, etc. And we'll see you guys on the next video. Thanks so much.